Why bariatric surgery patients need extra protein? There are a lot of things to think about before undergoing bariatric surgery for weight loss, not the least of which will be what kind of diet you will have to follow after the procedure is done. Your diet will obviously have to change a great deal, and it is very important that you get all the nutrients you need in your new method of eating, especially protein. Losing weight after bariatric surgery is not just a matter of sitting back and watching the pounds fall away. There's a lot of work ahead. You'll have to eat a balanced diet of 3 meals per day with good healthy snacks between. Protein should be a priority in your selection of food. Fortunately, there are a number of great tasting ways to get the protein you need while still keeping to your goal of weight loss and better health. Protein in food. Your physician will help you find the right diet plan for your post-bariatric surgery life. You can be sure that diet will be rich in protein because protein aids in recovery from surgery and provides energy to help you burn away those calories before they turn into fat. Protein is readily found in meat products, such as lean red meat, chicken and turkey, white meat, as the dark meat is much more fatty, and fish. All of these foods are loaded with the protein that you will need to recover quickly from the surgery. Milk and dairy products are another way to get the protein you'll need. Whey and casein are the base of many effective protein supplements because they are derived from milk as byproducts of cheese production. Be aware that dairy products can contain too much fat, however. Use skim milk products and cheeses made from skim milk in order to keep your fat intake at a healthy level. Eggs are another food used heavily in protein supplements because of their high protein content. If you've ever seen athletes swallow a glass of raw eggs, then you know how muscle growth was promoted before the development of protein supplements. Vegetarians, the lactose intolerant, and those allergic to eggs may consider the choices above very poor for their particular needs. Luckily, the choices do not end there. There are proteins in fruits and vegetables as well. Bananas, apples, broccoli, carrots, peas and strawberries all contain some protein. Soy is a powerful source of protein, considered by nutritionists to be a complete protein because it contains all amino acids, both essential and non-essential. There are also protein sources to be found in grains. The best choices include wheat, barley, brown rice, wild rice and buckwheat. Some oatmeal for breakfast could supply you with enough energy from protein to give your day the strong start it needs. Post-bariatric surgery protein supplements. Once the bariatric surgery is over, your physician will help you formulate a diet compatible with the changes. Many of these diets will include protein supplements. Because you will be eating less food, it is even more important to make sure you get enough nutrients to remain healthy. You're going to need 60 grams of protein every day after surgery, and this protein can come from food or protein supplements. In fact, protein supplements are often taken in place of food, serving as a substitute for breakfast or lunch. Protein supplements come in many forms. Your physician may have a recommendation for you, or it may remain entirely up to you what kind is best. As with many choices, it is probably a good idea to try a few before settling on one you find works for you. Powdered protein is a popular choice for patients with bariatric surgery. These powders are often made from whey or casein, which are produced from milk during the making of cheese. Obviously, lactose-intolerant people will not want to use this powder. Those who cannot consume dairy for whatever reason can also find protein powder made from soy, rice or egg proteins. Powdered protein is usually flavored and can be mixed to create shakes, usually chocolate or vanilla. These shakes often make a great substitute for breakfast. Powders flavored like fruit or berries are becoming more popular for smoothies or to add to fruit juice. There is even unflavored protein powder that can be seamlessly incorporated into a recipe. A banana, a little skim milk and a couple of scoops of chocolate or vanilla protein powder blended together with some ice is the perfect breakfast for the bariatric surgery patient. Liquid protein supplements. Liquid protein supplements have about as many options as the powdered proteins. You can get your drinks and shakes pre-mixed and just take them to go for a quick shot of protein when you need them. Some of these have a fairly high fat and carbohydrate content for bodybuilders and athletes looking to put on some muscle mass, while others are low in fat and carbohydrates. As a post-bariatric surgery patient, you will want to look for the latter. Some liquid protein supplements can be added to food or to drinks such as smoothies or shakes. Always choose supplements that are low in calories, fats and carbohydrates. Protein shots. This is a great way to get your daily protein requirement. ProfectR from Protica will give you 25 grams of protein in each small serving of less than 3 ounces. Their size makes them ultra-portable and they are great for a quick shot of protein just when you need it. You can get protein shots in flavors including grape, sour apple, raspberry and lime. Another protein supplement from Protica is ProfectR. ProfectR is an all-natural liquid protein shot. It is fat-free, free of cholesterol, free of aspartame and can be boiled and frozen. Due to all its many features, ProfectR is popular among many people. Bariatric surgery is not an easy choice to make and you should learn all you can about it before taking that step. Once you've committed yourself to it, set up a diet with your doctor and be ready to follow it exactly and completely. Without all the nutrients you need to get by from day to day, you could just end up in the hospital again.